My name is Lama Chogyal. I'm born in northern part of India. It's called Ladakh, known as like Himalayan regions, one of the highest mountain range in India. Some other people used to say it's a small Tibet, or some people they used to say Moonland, or some people they say land of Lama. So it's quite different from the other part of India.
I've been a practicing pediatrician for 35 years in Northern California. I went to medical school at the University of California in San Francisco. I did my pediatrics residency at Stanford, and then I've been in practice. After about 15 years of practice, I went back to school at the University of California, Berkeley, and got a master's in public health.
We have very large land, like it's one of the bigger districts in India. We have almost 300,000 people. I born in nearby city. It's called Spituk village. I left my home when I was 7. And then after I becoming the monk, I've been to South India for study almost 9 years. I studied there about Buddhism, about philosophy and debate. And after that, I went to Dharamsala, His Holiness Dalai Lama Monastery. It's called Namgyal Monastery. I was there almost 7 years. I believe karma, because Buddhism believe karma is, I think it's karma bring me to helping for the sick peoples.
I was on a spiritual journey with a group of Americans, and we went to a number of really wonderful places, visited a lot of monasteries, did a lot of driving, and I ended up in Ladakh.
In Ladakh, each village they have a family doctors. It's called Amchi. I came from that families, and my grandfathers, fathers, and all they are all Amchi. And so my 2 brothers also Amchi.
Shortly after that time, I had a life-threatening medical condition, and I got through that. And once I got through that and had the energy to do something, I started to figure out, what would be the best way to help the Ladakh Heart Foundation.
In Spituk village, we call its Amchi family is called Larche. Even though if they don't know my names, but if you know, okay, he's from Spituk, he's from Larche, that means everybody knows. The problem is in Ladakh, we don't have any heart specialists in Ladakh.
And I met Lama Chogyal and saw what he was doing at his hospital at the Ladakh Heart Foundation. And it was a life-changing event for me.
This is the hospitals. We just finished last year on September. So we start doing indoor patient since last few months. We started in October, and we have 4 or 5 doctors working with us, and we have pharmacists and laboratories on here, and also we have some almost 80 rooms we have. And then we have in most of the ground floor we want to do like testing things, like all the equipments and all these things.
The Ladakh Heart Foundation primarily was established to take care of all the congenital and acquired heart disease in Ladakhi population. So it will be doing both preventive work as well as curative work. Ultimately, it's going to be a hospital which will be much more dedicated to the cardiac side, cardiovascular side, but at the same time taking care of other services also in this population.
The Heart Foundation we started in 1997. And since we done very hard work, especially the doctor and physician and all the department, government health department, we work with collaboration to stop the acute rheumatic fevers. Now it's under control. No more acute rheumatic fever now. no more rheumatic heart disease because of education.
One of the problems they have in Ladakh is because of the long winters and the isolation geographically, you can only drive there through one of the two highest roads in the world. So the rest of the year you have to fly into the highest airport into the world to get in. So, and that is extremely expensive, so the families cannot afford to fly to New Delhi to, for example, get heart surgery.
Some of the families, they're very poor. They're just coming with their, with the problems and crying here and suddenly, if someone say, okay, you need a surgery. So because we are not like a Western, we don't have any health insurance policy on all these things. And people have, like if someone say, a doctor say, okay, your child needs a surgery. So, and they don't have money, and then start to come here in foundation and they started crying, to help for the boys and girls, whatever. And since last 10 years, we done a lot of, help.
So our first priority of the Himalayan Health Fund is to provide funding as soon as possible for the first operating room, a heating system, and power in the form of generators for the Ladakh Heart Foundation Hospital.
Over here we have a clinical lab. So in here, in the lab we have 3 people working. 2 of them are junior and the other one, the man, was a senior. He's retired from the government. So most of the worker here, a doctor and nurses and pharmacists they are retired from the government.
India is interesting and much different than North America in that they have a national health program and the physicians are required to retire at age 60. So since I'm also in that age group and I have a lot of pediatric care in me to deliver and I have all these patients that respect me, I would be very unhappy to be forced to retire at a relatively young age.
She's very, very, very special gynecologist person, Miss Dr. Lato. Very special. I like her very good. And very good person she is. Everybody like her very much. She's a very good, wonderful person.
It's my first time to be here, so I like the peacefulness and I come here. She is a very good lady doctor. First lady doctor who is very famous in Ladakh. So I just come for her, and I also do like this infrastructure also.
In India, in all of Asia, I imagine there's a lot of respect for experience and age. So the women want to see her rather than another obstetrician that doesn't have the decades-long history that she does in the community.
As first floor is not completed because we have lack of financial. So on the floor we still have to put marble or tile, whatever. So this one is mainly we are going to use like for the most of them operation theater, ICU care, and all these things.
I was so impressed with his dedication and his focus that he could be working 8 years, 7 days a week to create a facility to provide health care for the local people and the villagers in the mountains and the nomads in the mountains. And he could leverage a small amount of funds initially from His Holiness, the Dalai Lama, and turned it into this really beautiful, functioning hospital. And he just needed some funding to help finish the job. And that's what I wanted to get involved in.
And then in the future also we are planning to make a solarized water heating system. So now we don't have this thing, so we are looking for someone who can help for the company or for the solarize and also for the heating and also for the power.
The Himalayan Health Fund was founded to help support healthcare, education, and research in the Himalayan region.
Coronary heart disease, you can see in Leh, in the past people used to work in the farm, they have more physical work. Now this day the farming works is going less because of the constructions like guest house and hotel and shops.
As they start, some of them, to work in shops and restaurants and service industries for tourism, they're not getting as much physical activity, and so they're starting to get Western diseases like diabetes, hypertension, and cardiovascular disease.
And also the people economically getting better, and also there is like fake foods are coming from outside, and the diet, because also the lifestyle is also changing, and then the more coronary heart disease is coming.
In addition, they do all kinds of general medical things like sewing up lacerations, treating colds, bronchitis, pneumonia, skin infections, just general medical conditions that are not severe enough as to require a hospitalization.
And also what we are doing in Heart Foundation, not just focusing on the medicine, we are focusing on education, yoga and meditations. So we train some of the school teachers in the last year, we trained about the yoga and meditations. These are also good for the health.